Download our complimentary guidebooks, checklists, and other useful financial resources at savantwealth.com/guides.
Welcome to today's Savant Live webinar. Today we're going to discuss avoiding Medicare mistakes. My name is Joel Cundick. I'm a financial advisor in Savant's Vienna, Virginia office. And today I'm pleased to welcome our special guest, Margo Steinlage. Margo is co-owner, broker, and president of Steinlage Insurance. She is a fantastic resource. She knows a lot about Medicare, and we're excited to have her with us today. Welcome, Margo.
Thank you, Joel. I appreciate the time and allowing me to guest speak today. Let me just go ahead and share my presentation here. Again, my name is Margo Steinlage, president of Steinlage Insurance Agency, where we handle all things Medicare. So my goal today, and the reason you're joining us, is to find out more about Medicare. A little bit about myself and our agency. So I'm born and bred from the Midwest. I grew up in Missouri. We have our headquarters in St. Louis. However, we have clients in all 50 states. We are appointed and we can work with you regardless of where you reside. And I know Savant is in the same boat, but we provide free advice when it comes to anything around Medicare. Whether you are turning 65, needing advice on whether or not to come off your group plan or continue on the group plan, if you have a younger spouse who may be kind of hanging out there with a health insurance need, we can provide kind of a holistic consultation to discuss your family members and your own health insurance needs. If you are retiring early and you need ACA versus COBRA, gap transition advice to get you to 65 when you transition into Medicare, our team can come in and assist. If you are a high earner and you need help appealing your income surcharges, also known as IRMA, our team really handles everything in the Medicare space from A to Z, pre-enrollment consultations, holding your hand through the actual Medicare enrollment phase, and then we provide our excellent customer support on the back end when you do select some type of product, whether it's a Medicare Advantage plan or a supplement, also known as a Medigap plan. Our team helps navigate the space and lean in when there's a hiccup that can surface after you're already on Medicare. In addition, if you are already on Medicare watching this webinar, it'll be a great recap for you if you haven't touched your Medicare policy in a few years. This year, more than ever, is the year to review your coverage because of these changes coming down the pipeline with the Inflation Reduction Act. Our team is very proactive with our outreach to our clients every fall. We collect all of your updated drugs, prescriptions, doctors, your kind of snapshot of your current health so that we can make recommendations each and every year. Insurance, especially in the Medicare space, is never a set it and forget it policy. You want to get eyes on your policy each year. These drug plans can be very manipulative when they are setting their plan design for the next year. You may get an annual notice of change document if you're already on Medicare, and it'll look great. It's $0 premium or $10 premium. However, the bones of that policy are likely changing. Unbeknownst to you, your tier 1 medication went to a tier 3, going from a $0 copay to a $100 copay per month. So again, our team comes in and we really just provide this well-rounded advice on the front end and also on the back end when you are on Medicare. Again, it's always free to utilize our services. So we are here to support you.
We're lucky to have you this week, Margo. I know this is like the Medicare enrollment season, so you guys are a little busy.
It is. You guys can't, I'm wearing concealer, but you can't see my dark eyes. Our whole team, we have about 25 employees, and we're all pumping out 12-hour days. It's like our tax season, and if you know any CPAs, hug them because it's a hard 7-week marathon for us. So if you know any health insurance brokers, hug them. or just give us a call and we can work with you, and we don't need the hug. So
Sounds
again,
great.
we're in all 50 states, and yes, we do have clients in Alaska, which is pretty cool. So okay, anyway, today we are going to jump into really three moving parts. We're going to tackle who is eligible for Medicare and go over the nuances of turning 65. Do you have to sign up for Medicare? What are the rules in a closer, more detailed design? And then also, what is Medicare? If you have to take Medicare, or if you're coming off the group plan after 65, what are you signing up for? Which direction do you go? Do you go supplement? Do you go advantage, Part C? What are the pros and cons to each of these pathways? You know, I always say buyer beware. Get educated. Don't make this a last minute decision. Work with somebody who is really going over in fine detail each of these different pathways, because your initial decision into Medicare will have long-term consequences, and I'll show you why. So this shouldn't be just a quick, okay, yes, I'll take that plan, sign me up, 3 weeks before your 65th birthday. We recommend reaching out to your consultant. Hopefully you're going to use Steinlage, but if you don't, reach out to somebody and start this plan, start this 6 months or 12 months in advance of turning 65. Know what you're going to do, know what steps you need to take months in advance, because Medicare can drop the ball here. HR staff can fumble with pulling you off their group plan. There's just a lot of variables to consider that can cause hiccups and hurdles here. So start the process early. We're going to jump into what are these moving parts? How do they all get defined? How do they all work together? And then the last part of this presentation, the third part, we are going to look at the Inflation Reduction Act. What's coming down the pipeline with regards to drug changes in 2025? How does this affect you if you're delaying Medicare at 65? How does this affect you if you're coming off a large group plan in 2025 or a later date? Or if you're already on Medicare, what changes are coming down into Medicare for 2025, and how does it affect your pricing and your strategy if you're delaying Medicare? Okay, so who is eligible for Medicare? Without spending too much time here, the general rule is that you need to sign up for Medicare as you approach your 65th birthday. If you are working with a large employer, then there's an exception to this general rule. Again, the general rule, as you approach your 65th birthday, there's a 7-month window that you have to sign up for Medicare. The exception to that rule, because you have to sign up for Medicare at 65 or you'll get hit with penalties and gaps in your health insurance. The exception to this rule is if you or your spouse plan to work after 65. Then Medicare is optional if you are working with a large employer. So the size of your employer, if you plan to work or your spouse plans to work past 65, age 65, the size of that employer determines whether you have to sign up for Medicare at 65 and avoid penalties, or you can delay Medicare. So if the size of your employer, if your employer has 20 or more employees, it does not matter if they are part-time or full-time employees. If your employer has 20 or more full or part-time employees, then Medicare is optional. You or your spouse can delay Medicare at 65 without any penalties, without any gaps in your health insurance, and stay on that large employer-sponsored group health plan until you are ready to come off at a later date. And that carve off at a later date can be voluntary. You choose to come off mid-year, or you're retiring and you're getting kicked off the plan because you're retiring. As soon as you say, hey, large employer, I'm ready to come off this group plan at a later date after 65, you create a special enrollment window to get into Medicare Part A or Part B without any penalties or gaps in your health insurance. So here, again, if you have a spouse who is working and you are turning 65, you can delay Medicare to stay on that spouse's large employer group health plan. And it has to be active employment. COBRA is not deemed active coverage. So if you're on COBRA and you're turning 65, you have to take Medicare at 65. If you are turning 65 and you're working with a large employer for the foreseeable future, then you have the option to take Medicare or delay Medicare. So a red flag to watch out for here is if you plan to stay on that large employer group health plan and continue working, or your spouse continues to work after 65, then we need to watch out for something called high deductible health savings accounts. So if you have a high deductible health plan and you're contributing into an HSA, then we need to avoid signing up for Part A and Part B so you can continue maxing out your HSA at age 65, 66, 67, etc. So anytime you delay Medicare at 65 and you want to continue maxing out your HSA, then typically you're delaying both A and B. IRS does not allow you to contribute into an HSA and hold the free Part A portion in the background. Again, I get a lot of questions. Our team, sometimes 20 or 30 minutes of our consultation is just around this turning 65 scenario. You know, you're working, maybe have a younger spouse and children on that group health plan. You're turning 65. You plan to continue working after 65. What steps do you need to take so that you're not fumbling any Medicare rules? Your younger spouse isn't getting kicked off into Obamacare ACA, and your kids get to stay on good coverage. You know, are there any alternatives there? Can we manipulate your income to go ACA for the younger spouse and the children? Is it a better deal? I don't know until I get more information from our clients. And this is where our intake form will say, hey, what's your modified AGI? What's your family dynamic? What's your health insurance through your employer? Because we want to compare that to Medicare. A lot of times, if you plan to work past 65, it makes sense to delay Medicare and punt the conversation for another few years until you're ready to come off that group plan. So some of the fun, best advice I can give clients is do nothing at 65. It's an opt-in program. You enroll when you're ready to come off that group health plan. You tell Medicare when you're ready to come off the group health plan. Now, if it's a small employer, fewer than 20 employees, then Medicare is required to be the primary payer under Medicare secondary payer rules. So you need to sign up for Medicare at 65 if you're working for a small employer, if you have ACA Obamacare, or if you are on COBRA and you're turning 65, COBRA, ACA, or small group, you need to sign up for Medicare to avoid lifelong gaps or penalties. And then the discussion with you is, does it make sense to keep that small group employer as a secondary payer? So again, there's no one size fits all approach here. Our team, the first thing we're looking at is this scenario for a client. It's not black and white. There's a lot of gray zone in Medicare, and you can ask 10 of your friends, you know, what did you do at 65? And they're going to give you horror stories, or they're going to say it was the easiest thing, or they're going to say I pay $600 or I pay $0. Everybody's situation is radically different when it comes to the Medicare discussion.
Is the big difference, Margo, that you're looking at what the current health plan that they are on is covering in their employer? Is that the biggest factor?
I would say premium and what are the bones of the benefits? Do you have a high deductible? Are you maxing out the HSA? If you're not, then you're walking around with a pretty high exposure, you know, 5-6 grand worth of exposure. If you have a worst case scenario, you know, if your premium's $400 or $500, it may make more sense to go Medicare, where you have
Right.
less exposure. The HSA makes things a little bit unique for the client, and gives us a little more, it, it becomes more favorable to stay on the group health plan if there's an HSA and it's being maxed out. But we do look at your prescriptions. Is your group plan covering the prescription? Is Medicare covering prescriptions? Because that can play into your cost equation here. So once you're on Medicare, you can use those HSA funds that you've saved for the last few years, and you've accumulated in your HSA account. You can use those for basically everything under Medicare, except for your Medigap Medicare supplement premium. IRS does not deem a Medicare supplement premium as a qualified expense. Okay, so moving along here, what is Medicare? I know I'm throwing out a lot of terms: Medigap, Medicare Advantage. Some of you may say, Margo, what the heck are these terms? How do they work? Others, you're like, hey, I've heard this. So when you are ready to move into Medicare, you are going to get a red, white, and blue card. Our team is going to help you through the Medicare enrollment process to make sure everything is teed up for your desired transition date, whether that's at 65 or at a later date when you're coming off that large employer group health plan. When we've officially moved you into Medicare, you're going to get your red, white, and blue Medicare card. Everybody will pay a premium for Medicare unless you're low income and you're qualified for Medicaid. Okay, so Medicaid is separate from Medicare. Medicaid is for those who are low income. Medicare is what we're talking about today. So when you sign up for Medicare and you get your card, most of us will have a 0 premium on the Part A hospital benefit. This is because you or your spouse worked 40 quarters or more, which equates to 10 years worth of work history. And you and your spouse can piggyback off of each other's work history if you don't have enough work history and credits under your own Social Security account. So most of us have this Part A hospital benefit available to us. The Part B medical benefit of Medicare. So on your red, white, and blue card, you're going to see Part A and Part B when you're fully into Medicare. Most of us will have the Part A 0 premium. And then for the Part B, there's a standard Part B rate that's set by Medicare every year. For 2024, that Part B premium is $174. Next year in 2025, it's projected to go up to about $185. That is a non-official rate. We should have that official rate in Centers of Medicare Services, CMS. Medicare will announce that rate usually by November. So stay tuned there, but everybody will pay a flat rate for the Part B premium unless they are a high earning individual in the eyes of Medicare. So if you are a high earning individual, I'll give you a teaser here for a couple who are filing jointly, that's $206,000. If you're a single tax filer, that's $103,000. If you have a modified AGI above those benchmarks, then Medicare is going to cost you a little bit more. That surcharge or income adjustment is called IRMA. Okay, and we're going to talk about IRMA towards the end of this presentation, but I want to sprinkle it into our conversation right now because it comes into play when we are doing your consultation. Does Medicare make sense? What's Medicare going to cost you? We have to look at your income to see if you are a high earner. Is Medicare going to cost you more than the flat $174 per month? So everybody pays the base plus some more if you're a high earner. That is called IRMA. Now, when you sign up for Medicare and you have your red, white, and blue card, and all you have is your red, white, and blue Medicare card, and you walk in the hospital and you have a horrendous year with just your Medicare card, and you walk in the hospital, you show them your Medicare card, and then you have 6 months of follow-up treatment with physical therapy, outpatient services and surgeries, doctor visits left and right. What does Medicare cover? You can go to any doctor nationwide that takes Medicare, when you show your Medicare card for the hospital stays, you have a roughly $1,600 Part A hospital deductible, and then Medicare will cover the claim at roughly 80% with some copays. The Part B medical deductible for medical charges, so your doctor visits, your outpatient therapy, x-rays, diagnostic testing, etc., you have a smaller annual deductible of $240. Now, this Part A hospital deductible will reset every 60-day occurrence. So if you go in the hospital with COVID in January, and then 4 months later, you go in the hospital again for a heart issue, that Part A hospital deductible is resetting. You pay another $1,600 for your Part A hospital deductible. If you go in to see a provider, a doctor visit, or you need an x-ray or an MRI, you are triggering that one-time annual Part B medical deductible, and then Medicare covers the claim at 80%. Your remaining exposure is 20%. So these are the gaps in Medicare. Your $1,600 deductible per 60-day occurrence, your $240 annual deductible, plus that 20% remaining coinsurance after Medicare pays. There's no cap or ceiling on your 20% exposure. You'll also see here that there's no built-in drug coverage, dental coverage, hearing. All right, this is where you have ancillary products to fill the gaps in original Medicare, because your red, white, and blue card has gaps. How do we fill these gaps in Medicare? Now, if anybody on here is a federal retiree, Joel, shake your head if you have some questions on the chat with federal retirees. Or
Yes,
if you have TRICARE. I'm sorry to say this webinar is really not geared towards you, and Steinlage Insurance is not geared towards you. All right, we do not work with federal retirees or TRICARE military benefits. So this webinar is geared towards somebody who may have a retiree program at play with a private company, and they are looking at moving into Medicare. How do we fill your gaps once you decide Medicare is right for you, whether it's at 65 or at a later date when you're coming off that group health plan? Once we move into Medicare, you have your red, white, and blue card. There's really two pathways that you can select from. You may have an alternative third path with a retiree benefit that we can compare to these two pathways. All right, if you choose option 1 on the left side of the screen, you are looking at original Medicare, your red, white, and blue card being the primary payer, followed with a secondary supplement, also known as Medigap, and a third Part D standalone drug plan. You may get an ancillary dental and vision policy to cover you for those out-of-pocket charges as well. So this is option 1. You're walking around with your red, white, and blue card as your primary payer. This is also called traditional Medicare pathway or original Medicare pathway. Medicare is your primary. All residual bills will flow through to the secondary. The alternative pathway is to opt for a Medicare Advantage plan. These are called Part C Medicare Advantage plans. It's important to note that no matter which route you choose, if you go original Medicare with a supplement Medigap plan and a standalone drug plan, or you choose to go Part C Medicare Advantage, you are responsible, regardless of your decision, for this Part B premium, the $174 plus any IRMA. You pay that to Medicare, whether it's being drafted automatically out of your Social Security account, or if you set it up for auto pay out of your checking account, you are responsible for that Part B premium plus any IRMA, regardless of your decision here. So let's look at the nuances and kind of the pros and cons with these different pathways. if you select Medicare and a supplement and a drug plan, again, you have the ultimate flexibility here. Generally, clients will come to Steinlage and they'll say, hey, Margo, I want total flexibility. I don't want any third party managing my care. I don't want anybody telling me what to do. It's me and my doctor. I have kids in California. I have a home in Florida, or I just want flexibility. I stay in my simple lifestyle in Missouri, and I just want the flexibility. If that's you, then this is the pathway that you're likely leaning towards, the Medicare plus a supplement and a drug plan. I would say about 45% of the population goes supplement, and 54% of the Medicare population will go Advantage. All right, those are Kaiser Family Foundation statistics, not mine.
And I think you're going, Margo, with the same approach that Savant's using here when we advise on any financial planning topic. There's no path to intrinsically to steer someone toward. The idea is to explain the different options available so that individuals are equipped to make the decision.
Exactly. Because you can get razzled and dazzled by free benefits that look really attractive on the paper. But as soon as you start using care, you want to know what you're in for. You want to know the pros and the cons to each pathway. Get educated, which is why you're watching this presentation today. You want to be armed with information. So
yeah, and that's one of the biggest concerns that I find, that the clients that I've talked with about Medicare in the past who've worked with an outside professional, they will come to me and say, it seemed like Medicare Advantage was the only way to go. And you have to kind of look behind the scenes to, well, why are they doing that? And there's reasons why an insurance professional would steer you towards one or the other. But when you're talking with the right professional, they're explaining both paths to you, like you're hearing today, and explaining how it applies to you, and then letting you make the decision about what feels best for your situation.
Exactly. And we have, I would say half of our clients more than half are on the supplement. And then the slightly less than half are on the Advantage pathway. I could care less. My team could care less which route you choose. It's going to be based on your unique needs. We do a needs analysis for you and your ultimate decision. Again, the goal here is, what are those negatives to each pathway? What are the positives? So here, the positives of going with a supplement is that you have the ultimate flexibility. You can go nationwide to any doctor that takes Medicare. There is no network. You don't have to worry about your hospital dropping the Advantage plan or dropping original Medicare. 97% of providers nationwide accept and opt into Medicare. Here, if you go this level, you need to set up a supplement. This is where you have different plan letters. Plan F, if you're watching this and you've been on Medicare for the last decade, you probably have a Plan F supplement. Those who are new to Medicare will get a Plan G or a Plan N supplement. These plans with F, G, or N are all standardized by the state. So if you're in Virginia or Illinois or Florida and you have a Plan G supplement, it's identical. You go into the doctor with your red, white, and blue Medicare card and you say, I have original Medicare as my primary payer. Here's my supplement G. Regardless of who that carrier is, that provider is going to bill Medicare. Medicare is going to submit the claim to your supplement G on file, and that supplement G carrier is mandated to pay because Medicare was triggered. You remove this push-pull, you being the advocate for yourself. You no longer have to beg and plead with the insurance company to pay the bill. You completely have headache-free coverage here when you have this Medicare plus supplement combination. I say headache-free. I don't know if insurance can be ultimately headache-free, but the painless path, let's put it that way, in most circumstances. So here, that Plan G is going to cover you at 100%. Your only exposure, if you have Medicare and a supplement G, is this Part B medical deductible each year. So if you get hit by the bus, you're in the hospital for 2 weeks and then 6 months of post-op treatment, your only exposure there is the $240 medical deductible when it comes to a hospital and medical exposure. So it's excellent coverage. You'll never ask your provider, do you take AARP United Healthcare? Do you take Blue Cross? Do you take Cigna? Never ask that question because you're going to make the provider think you're in an Advantage plan. The question to ask is, do you take Medicare? Medicare is your primary payer, okay? In addition to getting a supplement, also known as Medigap plan, whether it's Plan G or Plan N with any of these carriers, you'll also need to set a standalone Part D drug plan. And this is where you have 30 different players in the field, in the market, offering Part D drug benefit. And we select one of these players based on your specific drug list, your preferred pharmacy, and we're looking at total cost. Who out of these 30 different drug plans is covering your prescriptions on the plan's formulary this given year at the most competitive rate? Is it a tier 2 versus a tier 3? Is it a co-insurance versus a copay? Is there a deductible? Is it a high premium with no deductible, low premium with a deductible? We're looking at all of these different factors to give you the best total cost. Premiums, deductibles, copays, co-insurance, and pharmacy all factored into that total cost.
So Margo, if somebody, I mean, you talked about being in Medicare enrollment season here. And if somebody is looking, they're already on Medicare, and they want to redecide some of these things, are you saying that Part D is something you do annually?
Correct. So what we do right now from October through December 7th is we shop these drug plans for our clients. So you definitely want to be reviewing your drug coverage. There's a lot of changes, which I'll discuss here in the next few slides. But this is one of the biggest things to do right now through the end of the year is to just get eyes on your drug coverage. Shop your supplement, make sure your supplement's competitive. That's easy. But we definitely want to get eyes on your drug coverage because that's where the most volatility is happening. Your premium skyrockets, it goes from $7 to $40+. Your deductible went from 0 to $590 for next year. Your tier 2 went to a tier 4, and now it's a 45% co-insurance. Holy cow, I take $1,000 med, 45% is outrageous. So a ton of volatility in this market. When we set this up for you with Medicare supplement and drug, we do this proactive outreach starting in August to get the updated drug list so that when this October 15th through December 7th timeframe comes around, we are giving you, hey, here's the top 3 plans, here's the top 2 plans, here's your current plan and the recommended plan, or saying, hey, stay put. Yes, your plan took a, 200% increase. It went from 7 to 45%, but it's still the best player based on your specific drug list. So we try to look at this for each client because of that market volatility. Now, in addition to the drug plan, you're going to add a dental and vision rider as well if you want that level of coverage. Here we're looking at your dentist. Who do they accept? Are they billing in or out of network? Or are you going to opt to self-insure? It's totally up to you, but it's something that would need to be added to this level of coverage because Medicare doesn't cover the routine and comprehensive dental, neither does the supplement. So here you're walking around with 3 cards: Medicare, supplement, and drug, potentially a 4th card, the dental. The negatives to this level of coverage, because I promised to mention both, is that you are paying premiums for all 3 or 4 plans. Medicare is a premium, supplements a premium, drugs a premium, and your dental's a premium. That can get expensive. So we have to budget and give you a big round, hey, your monthly nut here is $500 with Medicare, supplement, and drug. That's what you can anticipate, and you're going to pay it every month. On the flip side, when you are using care, you have close to 100% medical and hospital coverage. you meet that $240 Part B medical deductible, and you know what your out-of-pocket exposure is on the medical. The drug plans, you're capped at $2,000 for next year. We know what you can anticipate in your out-of-pocket exposure. There's not a lot of volatility when it comes to back-end medical exposure here. So the positive, total flexibility, and access to care, no red tape, no restrictions, and you know what your out-of-pocket exposure is from a very healthy year or a very sick year. Your out-of-pocket's $240 from a medical standpoint. Okay, so the alternative pathway, this is option one. You can go this level of care, or you can go with a Medicare Advantage plan. Remember, regardless of your decision, you're paying that Part B premium. When you sign up for this Medicare Advantage plan, you still pay Medicare your Part B premium. However, you're now getting enrolled in a managed care Part C Advantage plan. These are your HMOs, your PPOs. Most are zero premium across the country. A question I often get is, how can I get something for zero premium? Well, you are paying Medicare. You're required to have your red, white, and blue card, Part A and Part B in force. You pay Medicare, and you're required to have Medicare when you enroll in an Advantage plan. And as soon as you enroll in the Advantage plan, your Medicare will pay the Advantage plan a subsidy to offset their exposure, because your Advantage plan is now managing your care. Original Medicare is no longer the responsible primary payer. So Medicare is subsidizing these Advantage plans to now become your primary payer. Medicare pays those Advantage plans to manage your care in the background. Because of that subsidy, you can reap the benefit for zero premium. All right, so that's the fuel. The subsidy is the fuel behind the zero premium here. Now, when you start using care, you pay co-pays and co-insurance for all of your services rendered throughout the year. So it's zero premium on the front end. You pay if and when you need care on the back end. All right, so it's not free. You do pay when you utilize care. Co-pays for doctors, ER, hospital stays. You pay co-pays up to your plan's max out of pocket each year. And this is where, because of this Inflation Reduction Act, we are seeing a lot of shifts happening in the Medicare Advantage market. If you are already on a Medicare Advantage plan, I highly recommend reviewing it, because these plans are adding deductibles on the medication factor. They're adding deductibles on the medical side that we haven't seen in I've been doing this for 15 years. I've never seen the exposure like we're seeing in 2025 from a consumer standpoint. You're seeing deductibles, you're seeing those max out of pockets in a lot of the markets go from $4,000, $5,000, $6,000 up to $8,000, $9,000, $10,000. So new exposure means you need to shop coverage. Did your plan drop a drug off the formulary because it was too much exposure for them? Again, we want to capture the changes and make sure that you are not impacted by those changes. Also, if you are making this decision and you say, hey, Margo, hey, Team Steinlage, I'm healthy as can be. I bike 20 miles. I want the Advantage plan. Be aware that you are subject to the market changes every single year. It may be a great year to get into Medicare Advantage because they have a $3,000 max out of pocket plan that is giving you free fitness benefits, $1,200 back for ski and lift tickets and yoga mats and national park access, true story, and $2,000 worth of dental, but they strip that the next year, and now you're left with kind of a bare bones policy. And oh man, that supplement looks more attractive now. So again, just be aware that you are at the whim of the market in the changes that happen each and every year when you go into the Medicare Advantage plan. Whereas that supplement, the supplement benefits, the level G, level F, plan N, they stay the same. Your premium will adjust, but your benefits, the bones of the benefits, are not impacted by these, market changes and regulation changes. So here you're paying when you use care up to your plan's max, and then the plan pays 100%. You're also paying prescriptions, which are separate from that medical max out of pocket. All right, so buyer beware. Again, your initial discussion and initial decision will have long-term consequences. In most states, 44 of the 50 states, you have to answer health questions if you ever want to drop your Advantage plan and try to move over to this Medicare supplement market. So if you're saying, hey, Team Steinlage, I'm 65 or I'm 68 and I'm really healthy, I'm going to go with the Advantage plan, take on a little bit more exposure if and when I get sick, but I'm going to keep my monthly premium really low. If you say I want to go Advantage, I'll say, okay, well, remember the negative here, that when you want to drop your Advantage plan and move to a supplement, you have to answer health questions. And that's where you can get denied access to your supplement if you are deemed a high health risk. Are you taking tramadol? Are you taking Eliquis? Have you had any diagnosis in the last 3 years? They're not going to do a medical review on you like a life insurance, but they're going to ask your prior 3 to 5 year health history. Do you have any pending treatments? All right. So if the company says you're too high health risk, then you're locked out and you're kind of forced to stay in this Medicare Advantage market and shop the HMO to PPO, carrier to carrier every year. But you're locked out of this kind of Cadillac pathway called Medicare supplement.
And Margo, in that situation, if you were approved and you went back over to a supplement, is there any kind of penalty that you're paying because you waited?
No, you'll just pay the rate at the 68-year-old rate. And if they approve you, then there's no pre-existing limitation or anything like that. They're
Great.
giving you the approval to come to the plan based on your health risk. If you're approved, you're in. Great. If you're denied, then we have to shop the Advantage market for the next year. Another, just kind of, let me take a step back moment. When you are new to Medicare, you are coming into Medicare because you have to at 65, or you're coming off your employer plan after 65 and you're signing up for Medicare at 70 because you're retiring. As soon as you're new to Medicare, you trigger a 6-month guaranteed kind of open enrollment window around your supplement. So that means when you sign up for Medicare, we can pair you with any of these supplements and avoid the health questions. You're guaranteed access and enrollment when it's paired with your Medicare start date, your Part P start date. Again, if you delay signing up for a supplement and now you're 7 months or 7 years past your Medicare start date and you're trying to move supplements or you're trying to move Advantage over to supplement, health questions are going to be required. So again, even if you choose this Medicare supplement pathway, buyer beware. Don't go for the super low rate because they could be flooding the market with a really cheap product. And now, 2 years later, they've increased your premiums 20% year after year. And now you're stuck with that supplement because, again, in majority of the states, you have to answer underwriting to move supplement to supplement and rate shop your supplement carrier. All right, so there can be some restriction on even shopping your supplement a few years after you set it. So buyer beware, make a wise decision, make an educated decision here. The drug plans, we can move drug plan to drug plan very easily each year. We can move Advantage plan to Advantage plan easily every year. But again, anytime you're shopping the supplement market or trying to go into the supplement market and you're outside of that 6-month window of being new to Medicare, plan on health questions in the majority of states. All right, so right now is the open enrollment, annual enrollment, excuse me. This is when this is for those of you who are already on Medicare. If you are not quite 65, you're not quite on Medicare yet, ignore all the hoopla that's happening right now. It's not impacting you. It's only for those who are already on Medicare. If you're on a Medicare Advantage plan and you do nothing during this October through December 7th timeline, there is another kind of safety net window from January to end of March where you can make a one-time change on your Advantage plan, or you can try to underwrite and come off the Advantage plan and move to a supplement, but you have to pass underwriting and you'll have a special open enrollment window to come into a drug plan if you get approved on the supplement. So there are some consumer protection windows here. If you sign up for an Advantage plan because somebody told you your doctors were in the network and they all show up in network online, but then when you go to the provider, they say, that's a mistake. There is no, we do not bill that company. There is some consumer protection built in that you can change your Advantage plan one time during that January through March timeframe. Outside of that, you're kind of locked into the coverage until the following annual enrollment period when it comes to drug coverage and Advantage plan coverage. Again, the supplements are not part of this annual enrollment period in the fall. We can shop your supplement any given month to find a new, more competitive product, but you're always subjected to the health questions unless you're in a handful of states that allow for ease in movement. So if you're already on Medicare and it's October 16th and you want to shop your drug plan, this is the time to do it. It can't hurt to also look at your supplement while you're shopping your drug coverage, but it's not required. All right, IRMA, I told you I'd talk about this. Unfortunately, again, we're at the whim of Medicare releasing the 2025 IRMA brackets. So I am looking at what we have in hand right here is the 2024 amounts. So everybody pays that standard Part B premium regardless of your decision if you are going original Medicare with a supplement or an Advantage plan. If your income, your modified AGI, is above 206,000 as a couple right here, or if you're above 103,000 in modified AGI, then your Medicare premium will be higher than normal. And what Medicare is looking at is your prior 2-year tax return. So when you move into Medicare, let's say you're turning 65 November 1st of 2024, and you have your red, white, and blue card, you're going to pay the $174 plus any IRMA if your 2022 modified AGI on file is above these two benchmarks, 103,000 for a single or 206,000 as a couple. Then in 2025, Medicare is going to automatically update your Medicare premium based on your prior 2-year look back. So for 2025, Medicare is using your modified AGI for the household from 2023. That happens automatically. So you're never stuck in these income brackets because of the year that you enroll in Medicare. You will automatically see an update based on the prior 2-year tax return. And those IRMA notices come in December. Sometimes Medicare's got their stuff together and it comes out a little bit earlier. But generally the first or second week in December, happy holidays to everybody. Here's your IRMA for next year. Or it is a happy holidays and you're getting a reduction. So you're never stuck. This is automatically updated year after year. Also being updated year after year is this entire screen of bracket with the chart. So next year you'll see this income threshold 206,000 increase by a few $1,000s. Same with the single tax filer. And then you'll see your Part B premium increase. You'll see your Part D IRMA, whatever drug plan you select, if it's a Part D drug plan or a Medicare Advantage plan with built-in drug coverage. If you are a high earner, you'll pay an IRMA income surcharge on both Medicare B premiums and any drug plan premium. Even if you're in the zero premium, it has built-in drugs, so you would see an IRMA surcharge on that zero premium plan. All right. IRMA, income-related monthly adjusted amount. Not some random lady that I'm talking about. Okay. If you are filing separately, married but filing separately, there's another chart that's applicable to you. I want to throw that out there. Now, what Medicare has no idea is they're not privy to life events. If you have a life event like retirement or work reduction, you're turning 65 in November of this year. Medicare has your 2022 modified AGI on file. They're slapping an IRMA on your Medicare Part B premium for November and December. You retire for January 1st, leaving your 2025 anticipated income much lower than what Medicare has on file from 2023. We can tell Medicare, hey, don't use my prior 2-year tax return if you've had one of these life events. So if you're retiring, we're telling Medicare, do not use my prior 2-year tax return. It's stale. Instead, here's my anticipated modified AGI for 2025 because of this life event: work reduction, retirement, death of a high-earning spouse, divorce from a high-earning spouse. Those are the 4 most popular ones. Now, working with our advisors here, we like to bring in Savant to say, hey, can you help our client anticipate and really massage this anticipated modified AGI figure? That falls outside of my scope and expertise here. So we like to bring in your advisor to say, hey, we need help figuring out what's happening here for 2025 based on this life event, so that we can tell Medicare, don't use that prior 2-year tax return, rather use this new updated figure and remove or reduce my IRMA owed for 2025 based on the lower anticipated modified AGI.
Yeah, and that's just like where we kind of take over. There's so many things that are impacted by your income every year in retirement. This major transition, that is a place where it is really good to get tax advice like you've never gotten before, because you were just earning income every year throughout, and now you've switched to being a retiree, and now there's all these new questions about when should you time income and what things can you do if your income's low. This being one of them, how to manage IRMA.
So we help you appeal. We're kind of poking holes to see if you are in the camp that a successful appeal will happen. And if you're falling into one of these life events, our team helps you work through this appeal. We also do a lot of webinars for our current clients to put this appeal back on their radar. Because, hey, maybe you're starting required minimum distributions, or you started that 2 years ago, or you had a home sale, and now you're getting another notice. You haven't had IRMA for 4 years, and now you're getting a notice, and you forget what is IRMA. Our annual enrollment review that we send out to all of our current clients goes over these updated changes and puts this IRMA back on your radar as a reminder to appeal it if at all possible. Because you can see here, if you're in that highest earning bracket, you're looking at $6,000 a person in IRMA, close to $6,000 a person in IRMA. And if we can appeal that, that's fantastic. These are per person per month figures here. Okay. Joel, I'm sorry, I can talk about this all day. Okay, real quickly, Inflation Reduction Act. There is a ton of noise out there, the Medicare math. What is happening? So in years past, we had this donut hole exposure, a gap in the Medicare Part D program, where if you were on very expensive medications, you paid 5% once you went through all stages of the drug program, donut hole to catastrophic. So if you were on a $20,000 med, your potential exposure was 5% of that per month until the end of the year. So we had clients who were paying 13, 15 grand worth of drug exposure for the year, and it was just outrageous. So what's happening with this Inflation Reduction Act, one of the biggest changes is that it is putting a cap and it is eliminating the donut hole and this catastrophic exposure that you always had under Medicare. And it's putting a $2,000 cap for your out-of-pocket maximum for 2025. So if you're on the $20,000 medication, the key here is to finding the drug plan that covers your medications on its formulary. So because of this $2,000 cap for 2025, we are seeing a lot of changes with the premiums on the drug plans, a lot of changes with deductibles coming in, and a lot of formulary shifting, carving off medications because they're too expensive for the drug plans, having really watered down formularies that just cover generics. So the key here for next year is, hey, you won't be exposed to really high cost on your medications if you are in the right drug plan that covers your medications on its formulary. If you're paying out of pocket for non-formulary medications, those costs do not go towards this $2,000 limit that Medicare's placed. All right, so the key here is to finding the right drug plan with the formulary. So come January, you're on your $30 drug plan. All 5 of your medications, your Eliquis, your Jardiance, your Victoza are all covered on your plan's formulary. You may have a great plan that covers those really expensive 1,000+ medications at a flat copay. That's the key to finding a great coverage for next year, is finding the plan that has the tier 3 at a $47 copay, because your costs are so much lower. And it might not be possible, but if you can, that's key, and you're on expensive meds. So if you're on one of these drug plans for next year, you go in and you fill your medications at the pharmacy, or you're doing mail order. You may or may not have a deductible. The most you can pay in deductible phase is $590. So your $1,000 med, you're going in to fill it at CVS in January, you're paying $590. Now you're put into that initial coverage phase on your drug plan where you're paying either a flat copay or a 25% coinsurance. Whatever the variable is there, you are paying something for that $1,000 med for the next few months until you hit $2,000 in true out-of-pocket, which is what you pay in deductible, copays, and coinsurance up to $2,000. Once you hit the $2,000 in copays and coinsurance out of pocket, then $2,000 is your cap, and now the plan comes in and pays 100%. Great for you if you have very expensive meds, not so great if you're on cheap generics, because we're at the whim of these drug plans increasing their premiums, modifying the formularies. And unfortunately, you may have to pay a little bit more on your drug coverage than you have in the past to offset that drug plan's exposure. So again, a lot of shifting on benefits here that we want to get in front of and make sure you're on the right plan, and help you select the right plan if you're new to Medicare in the next year or two. We can shop the drug plan every year without health questions, but you are locked into that drug plan for the full year once you move into it. Also, if you're on medications that are over $600 in retail costs, there's this new smoothing provision where you can spread out the $2,000 exposure over 12 months, which comes to about $167 a month. So instead of going in January and coming out of pocket $2,000, if you're on really expensive meds, you would pay $167, which equates to 12 months at 12 months times 167 is $2,000. So that's nice for somebody who is on a fixed income and just wants to spread their risk over the course of a year. Also, I'm going to just put this out there. If you are staying on your large employer group health plan, 20 or more employees, you're delaying Medicare, you need to watch out and make sure that it remains creditable coverage, and ask your HR team to make sure that it is creditable. And what that means is your employer plan meets the qualifications under Part D. They offer drug benefit under that large employer group health plan benefit that meets Part D's requirements. And it's either as good or better than what Part D offers. If that's the case, then the large employer group health plan is creditable coverage and you avoid any Part D penalties down the road. Now, because of this $2,000 cap that's coming into play for 2025, the group drug plans may become unqualified or uncreditable. So make sure you're checking in every year as you delay Medicare in 2025, 2026. Always touch base with HR to make sure that that employer-sponsored group health plan remains creditable on their drug status. One minute over. Okay, so I could talk about this all day. It's what we do here at Steinlage. Get a jump on this conversation. If you're new to Medicare, you're turning 65 in the next 1 to 2 years, meet with our team, meet with somebody who is educated in this space. There's a lot of misinformation here. Do feel free to reach out to us. You can reach out to Joel and Savant to get in contact with me. They will have my information up, but my advice here is review every year, and if you're new to Medicare, make sure you're getting the quality advice here on both sides of the equation. Watch these presentations, they're really good. Just be armed with information, accurate information.
Thank you very much, Margo. Very, very critical word, accurate information. We're thrilled to have you with us today. Glad you could all join us. There will be a link that will come out to you afterward to a recording of this. So if you missed anything, you can slow down, speed up, watch it in reverse. There'll be time for you there. We tried to cover as many questions as we could throughout the webinar. You're going to get a survey immediately after we close here. If you feel like you have a question that wasn't answered, and I know there were a few, please throw the question in there, and we'd be happy to have somebody reach out to you and get you an answer. All right. So as Margo said, you can reach out to steinlageinsurance.com. You're welcome to reach out to savantwealth.com. This is what we love. We love doing financial planning, and Medicare is an important part of that. So please have a wonderful day. Thank you for your attention, and good luck.
If you enjoyed this webinar, visit savantwealth.com/guides and download our complimentary guidebooks, checklists, and other useful financial resources.